Special Operations Medics are combat multipliers on the battlefield. Their proficiency in combat medicine, coupled with warrior skills, is unequaled. The path to becoming a Special Operations Combat Medic begins at the Joint Special Operations Medical Training Center at Fort Bragg, North Carolina, during the Special Operations Combat Medic course. Potential Special Operations Combat Medics are enlisted personnel from the Army and Navy who hold or are designated for assignment to a Special Operations medical position. This course qualifies these enlisted service members as highly trained combat medics with the capability to provide medical and trauma care and increase team survivability. SOCM is designed to give the Special Operations Combat Medic the knowledge and skills required to manage combat casualties from the point of injury through evacuation to a surgical facility. Following the course, Special Operations Combat Medics are assigned in various direct support positions in the United States Army Special Operations Command. Navy personnel will go on to serve with the Marine Special Operations Command and Naval Special Warfare. The students who complete the course are among the most medically and tactically proficient combat medics in the world. SOCM is comprised of 7 separate academic blocks totaling 36 weeks of training. The first phase of the course is the Emergency Medical Technician block, which takes a candidate with little to no medical experience and creates a certified National Registry Emergency Medical Technician, or EMT. This training consists of initial physical fitness testing, CPR certification, medication administration, and pharmaceutical calculation. The next phase, Clinical Fundamentals, lays the foundation for understanding human anatomy and physiology. Students utilize human cadavers, anatomical simulators, and human patients during the physical examination sequence, which gives them an understanding of normal anatomical structure and function, as well as knowledge of how to perform a basic physical exam during a patient encounter. Also, students learn basic pharmacology and pathology. Clinical medicine builds on previous training by focusing on key aspects of clinical and field medicine. Building upon the previous fundamentals, students learn to understand abnormal presentations and findings. Students will also rotate through clinics dispersed throughout Fort Bragg, treating patients under the supervision of healthcare providers. Trauma 1 exposes students to the concepts required to treat trauma patients. Students learn to perform trauma assessments along with ultrasound training. During this block, students are credentialed in pediatric education for pre-hospital professionals and advanced cardiac life support. Trauma 2 forces students to take all of their training to date and put it together to assess and stabilize a multi-system trauma patient, prepare them for evacuation, and perform advanced trauma surgical skills. Trauma 3 is the final block and assesses all of the students' tactical combat casualty care skills by forcing them to treat multiple combat casualties with limited resources in an austere environment. In prolonged field care, students are exposed to state-of-the-art medical simulators and tested on their ability to manage a team and maintain a trauma patient for an extended period. Their training is put to the test in a 72-hour culmination exercise, which forces them to critically think and apply their medical knowledge in a tactical environment. Clinical rotation is the final requirement for graduation and is comprised of a 30-day clinical rotation at urban trauma centers throughout the United States. Students work closely with experienced healthcare providers and paramedics in a real-world environment. Upon completion of the course, the new combat medics will take all of the knowledge they have learned and put it into practice at special operations units around the world, at home station, and on the battlefield.